Hi guys! My name is Alina. Today we're going to be talking about multiple sclerosis. It is autoimmune disease that affects central nervous system, brain and spinal cord. We don't know why it happens, but there are some risk factors like relatives, first-degree relatives, infection, smoking, emotional stress, pregnancy, or overall poor health. We do know that it is more common in northern regions, in Caucasians, and women are 2 to 3 times more likely to have it. Alright, so today we're going to be talking about pathophysiology. And for me to discuss it properly, we have to look at the 3 main steps: chronic inflammation, demyelinization, and gliosis. Let's look into chronic inflammation and how it happens. Our naturally present blood-brain barrier is there to protect us from bacteria entering the brain or viruses. However, when a susceptible individual meets environmental trigger like infection, the T cells that are not supposed to be there enter the brain. They go to the brain, they go to the neuron, and they see myelin sheath as foreign object, which is not good because then they trigger immune response and they release cytokines. These cytokines further disrupt the blood-brain barrier, but they also call for help, and they call their friends B cells. So B cells, they create antibodies to evil myelin, and they travel with antibodies and further destroy the myelin. And this is how demyelinization happens. Moving on to the next step, gliosis. So after inflammation subsides, brain can heal itself, and this is the process of gliosis. So the cells that are present there, that are used for maintenance of the neurons, for example, oligodendrocytes, these cells go to the myelin and they try to repair it until they can't repair it anymore. So once the neuron dies, they patch it up and they place fibrous tissue, and it creates a scar. So these scars are hardening tissue. They are sclerotic tissue in multiple places in the brain, and this is where the name comes from, multiple sclerosis. And you can see those hardening tissues on MRI. Now I would like to go over the most common signs and symptoms reported by the patient. Those include fatigue, muscle weakness, walking gait difficulty, vision problems like double vision or loss of vision, or jerky movements and tics, bladder control issues, and just numbness and tingling. Talk about assessment. Neurologists can do an assessment and tell where the lesion is located, roughly. Let's say when you will be doing Romberg test, the balance test, if it's positive, then the lesion is in the cerebellum. We can also tell if whether the lesion is an upper motor neuron or lower motor neuron. And if you recall, motor cortex has upper motor neuron that connects and synapses to the lower motor neuron. And that lower motor neuron is connected to the muscle. And that's how, you think about moving an arm and then you move it. If the lesion is located on the upper motor neuron, everything is going to be increased. So we'll have increased deep tendon reflexes. Our Babinski will be positive. We will have ankylosing and spastic hemiparesis. If the lesion is on lower motor neurons, then everything is going to be low. Absent or decreased deep tendon reflexes, flaccid muscle, some twitching, and foot drop. Alright, thank you so much, guys. This concludes pathophysiology, complications, and assessment. And please continue below to see what my classmates have to offer.